Hello friends, this is Onisha. Today again we'll see some set of questions that will be asked in nursing competitive exams like AIIMS and JIPMER. Let's move on to the questions. First question, the intensive care nurse is caring for a client diagnosed with a traumatic brain injury who is exhibiting decorticate posturing. 3 hours later, the client has flaccid posturing. Which action should the nurse implement first? The options here given are notify the client's healthcare provider immediately, prepare to administer mannitol and osmotic diuretic, complete a thorough neurological assessment on the client, reassess the client in 1 hour, including calculating the Glasgow Coma scale, the GCS. So, the right answer for this question is first one. So, notifying the healthcare provider is the correct answer. Why? Because flaccid posturing is the worst case scenario for a client with traumatic brain injury. Therefore, it is very much necessary for the nurse to notify the healthcare provider because completing a neurological assessment, administering osmotic diuretic, or reassessing the client, or all these are plausible interventions and they are not to be implemented very fast. The very first implementation that has to be done is notifying the healthcare provider. We'll move on to the second question. The emergency department nurse is entering the room of a client who was at a baseball game and was hit in the head with a bat. Which intervention should the nurse implement first? So the options are assess the client orientation to date, time and place, ask the client to squeeze the nurse's fingers, determine the client's reaction to the door opening, request the client to move his lower legs. So these are the options and the correct answer is the third one. The nurse first should determine how alert the client is by noticing the reaction when the door is open, because the nurse has to see the best reaction, that is spontaneous opening of the eyes without verbal or noxious stimuli. The other three options are appropriate but should not be the nurse's first intervention when entering the client's room, because the question itself is asked what is the first intervention that has to be done when the nurse is entering the client's room. So this is the correct answer. We'll move on to the next question. The nurse is preparing the client diagnosed with a head injury for a magnetic resonance imaging, that is MRI. Which intervention should the nurse implement? Select all that apply. So there are options. We can select how much ever, which interventions. So you can select one or two or more than that. So the options are ask the client if he or she is claustrophobic, have the client sign a procedural permit, determine if the client is allergic to shellfish, check if the client has any prosthetic devices, ask the client to empty his or her bladder. So these are the options they have given. So what has to be selected? What is the right answer? Yes, correct answer 1, 4 and 5. So the client is enclosed in MRI room for a extended period. So the client cannot be claustrophobic or want to stop the procedure. So we have to see whether the patient is claustrophobic or not. Next, MRI cannot be completed on a client with a metal prosthesis unless it is made with titanium. So if the patient is having any processes, we cannot continue the procedure, so that has to be checked again. And the hospital admission permit covers the MRI, not a contrast dye. In case of contrast dye is used, we can check for the allergy, or else it is of not needed. So the correct answer is first, fourth and fifth option.